Welcome to the Possibility Action Network podcast. I'm your host, Stephen Middleton, aka Possibility Man. We're committed to bringing you guests who strive to better people's lives and serve as a force for good in the world. Our guest today is Dr. Harrell Jordan. He is a registered nurse with a master's in nursing and a doctorate in nursing also. He is a scholar, a nurse educator, and has a passion for research and writing. Dr. Jordan, welcome to the show today.
Thank you so much. I'm very glad I'm here.
Yeah. Hey, look, we're going to get into all things nursing concerning you, but I'm curious, where did you grow up in the United States?
Absolutely. So I was born and raised in Chicago, Illinois, west side of Chicago to be exact, because there's a difference between the west side and the south side.
Uh,
So west side of Illinois, Chicago, and eventually for my undergrad, I went to U of I in Urbana-Champaign. I attended there for 4 years. My degree was in public health or community health. And at that
uh,
time, I was pre-med. So I thought I wanted to be a pediatrician. But eventually, after taking the MCAT twice, it said, absolutely not. That is not the route for you.
yeah.
So I figured what else I can do to try to impact my community and stay within the healthcare field. And with all the knowledge that I'd gotten and the coursework I'd already taken, I made the
Uh,
decision to transition to nursing.
uh-huh. Now, but you mentioned something a moment ago that many of us will not know about. You mentioned the west side of Chicago, and was it the south side of Chicago?
Southside,
What
yes.
what's the difference in these two areas of Chicago?
Well, it actually branches all the way back to its inception. However, I can speak more to my own experience. So,
Okay.
if you are a member of Chicago, that's kind of how we delineate the type of person that you likely are. So,
Oh,
you'll ask if you are West Side or South Side. The North Side kind of means something as well, but it's either West or South. To
yeah.
be quite honest with you, there's always been that rivalry, like the West Side is better than the South Side, what have you. And like I said, there are pieces in history where that stems from because initially Southsiders are the ones that matriculated to the West Side based on economic status. Um,
Oh,
but ultimately, those things kind of trickle down into us now. But if I'm being quite honest, especially in Chicago, West Siders and South Siders, no matter what, the economic status is the same, and we're both living below poverty lines.
I see. Okay. Well, thanks for that tip for those of us who are not Chicagoans. Yeah.
Yeah.
Hey, look, so you mentioned wanting to be a pediatrician. So at what point in growing up did you set your sights on becoming a healthcare professional?
Yeah. So I can say it probably was stemmed from seventh grade. We had a career day at my school in which
Uh,
we saw a bunch of different careers. We saw the stenographers from the law office, and we saw teachers, and those never really tickled my fancy, so to speak. But then we saw a pediatrician, and she explained her role. She explained the job that she does as a nurse, as a doctor, and she also spoke to her salary. And so in being in seventh grade, I'm like, oh, I like kids and I like money. So why not
right.
be a pediatrician? And from there,
Yeah.
I just really had my sights set in the healthcare field.
Wow, that early. So you were really a focused kid going through middle school and high school, knowing, I think that you would become a medical health professional. Wow.
Yes, yes, it
Yeah,
started
yeah.
very early for me.
Uh-huh. Okay. And then you told us a moment ago, you said at some point your radar landed on nursing. Will you walk us back through that again?
Yes. So I mentioned taking the MCAT. So that is that exam that you have to take in order to get into medical school. I took the MCAT the first time when I was in undergrad. It was the summer of my junior year, and I scored terribly, even though I'd gone through all the science classes, even though I'd even taken one of their MCAT prep programs to try to get me as prepared as possible. I did not do well. And so with that, I had to figure out what my next step would be because I knew I didn't want to take gap years or years off. I knew that I needed to go into something that would help me to get to my goal. So I ended up going into a post baccalaureate program where you already have your bachelor's degree, but you have the opportunity to, at least within this program, you have the opportunity to get more exposure to classes you may not have been able to take in undergrad. So in that program, I was able to take um, genetics. There were more biology classes, pathophysiology that would kind of help to boost my curriculum when applying to medical school again. And I also took a class called Topics in Medicine. And so
Mhm.
that Topics in Medicine is where they actually had different healthcare professionals come in to just tell us what we might be able to get into besides being a regular MD. And at that point, we had a nurse practitioner that came in to speak to us. And so I knew that that was a viable option. Then I took the MCAT again. And wouldn't you know, after all those years and more studying, I got the same score. And the
Uh-huh.
only thing that went up was the grade I got in writing. My writing grade was always phenomenal, but nobody cares about writing when you're a doctor.
Right.
So that definitely gave me an inclination that I needed to look into some other route. But I didn't want to stop because just having a bachelor's degree in community health, that wouldn't get me where I thought I wanted to go. So I looked into
Mhm.
becoming a nurse practitioner with the schooling I already had. And so I met the qualifications for a master's entry to nursing practice program. And
Uh-huh.
my nursing career launched from there.
Okay. So you became, you got your master's in nursing before the RN or the RN before the master's?
I got them together. So
You got them
the
together.
way
Okay.
the way that it worked was I had a bachelor's degree in something and I already met their qualifications to get into the program.
Uh-huh.
But they knew that I didn't have any nursing background. So I would have to take the nursing courses that everyone else takes, in addition to master level courses for like writing. So I ended up doing a literature review. And at that time, it was focused on the healthcare benefits of mentoring. So I
Uh-huh.
had to do them simultaneously in an
Mhm.
accelerated nursing program where you get your master's degree in under 2 years. At least that's what it was at that point. And then you take your NCLEX just like everybody else. And I passed that the first time. And
Yeah.
I went directly into being a nurse with a master's degree.
Uh-huh. So now you were thinking all the while, high school, in college, that you would become an MD, a medical doctor,
Mhm.
and now you are pursuing nursing. At what point did you fell in love? Did you fall in love with nursing as a career?
Yeah. So it's funny that you say that because I can even take a step back to when I was in that post-bac program. We had to
Uh-huh.
do some role playing once, and you would pull a name, and you were either going to play the doctor or you were going to play the nurse. And I pulled nurse, and I remember getting upset because I'm like, I didn't come here to be a nurse. Like I came here to be a doctor. That's not what I want to do. But the role of the nurse, even as I was playing it, you have more patient interaction than you do as a doctor. Like you're
Mhm.
getting down into like social ramifications of health as well because you have a bit more time to spend with the patient. And that was the first time I was exposed to that. Then, as I was in the nursing program with the thought of becoming a nurse practitioner, I definitely had my clinical experiences where I had more hands on experience with patients and figured that it was a better niche for the type of person that I am. I'm pretty compassionate. I like to listen and I like to really hone in and figure out where the opportunities are to get you to
Mhm.
make better health choices. And I don't think that we have that opportunity as much in just as an MD. I think there's so
Mhm.
many patients that they're seeing, they just have to be in and out, prescribe and move on. But the nurse at the front line, we have the opportunity to shift a lot of mindsets.
Yeah, yeah, and from my experience in visiting hospitals and the like, the nurse has more interaction with one patient than the doctor may have in a given, let's say, 4 hour period. So,
Exactly.
um, yeah,
Exactly.
but you could have had a great career as an RN with a
Mhm.
master's in nursing, but
Mhm.
you went on to pursue a doctorate. What
Yes.
prompted you to continue on?
Yeah, sure. So in my master's program, towards the end, I want to say my last 6 months or so, they had a bridge to PhD program that I could enter into. So I went to an informational for that program in which they had some individuals who already had their PhD and they were trying to publicize why we should go beyond just the master's degree. And one man in particular looked directly at me and said, "We need more of you in academia."
Mm,
And in him saying that to me and pointing directly at me, because there
Yeah.
was no mistake that he was looking at me at that point. I really started to reflect on the number of men in nursing that I'd ever come in contact with, let alone the number of Black men in nursing that I'd experienced, or even in my whole life in education. And I could count them on one hand. And I
Mhm.
knew that even in my cohort at that time, there were 70 of us. And I don't think I was surely the only Black male there among
Mhm.
7 men. And I knew that I wanted to be an example for others. So if not for anything else, I went to pursue my PhD to be an example so that other Black men knew what was possible.
Yeah, yeah. And look, I mean, there are a lot of statistics. I did some checking on you. A lot of statistics swirling around you as a male with an RN, with a master's and a PhD. Do you recall some of those stats? Because I can throw them out you if you don't recall them.
Oh, one thing I could tell you that I found out after graduating from
Yeah,
my PhD program was that the number of African American men in nursing leadership positions is unquantifiable. That's how small
yeah,
it is.
yeah.
Um, my most recent stat, which is probably what you're referencing, is the fact that I was the first African American male to graduate from the College of Nursing with their PhD
Mm,
from the University of Illinois, Chicago.
mm. Yeah, yeah, and there's one more thing I saw is
Okay.
that over about I think about a 4-year period, there were only 5 Black men who graduated with the PhDs. That's what only 5. That's amazing. Yeah, and in for RNs, there's a stat about registered nurses who happen to be Black. You recall what that is?
I don't recall that stat.
It's like less than 1%.
Mm,
And this is like up to about 2023, less than 1%. So surely there's a great opportunity there for a lot of other individuals. Let me ask you this.
sure.
When you begin telling, your family, your friends, I'm going to become a nurse, did they give you any pushback on that?
I don't remember any pushback in that area. I think I should say, had been so drained from the process of trying to pursue medical school that my switching to a career that really fit the type of person that I was wasn't necessarily a shocker. My parents have always been very encouraging, and my family has as well. So the fact that I was pursuing higher education in any capacity, they encouraged and appreciated.
That's fantastic. What about your cohorts in the nursing program? You're surrounded by what were there any kind of reactions from them? Having only
So
a few, yeah.
yes, so as I stated before, I think I said a cohort of 70. It was probably more like 65. Of those 65 people in my cohort in particular, I remember there were 7 men total. And of those 7 men, I was the only Black male. So the
Mhm.
men kind of stuck together in a way because there were perspectives that we shared in being men in nursing. And we all had some other career choice in mind prior to coming into nursing. That was something unique about the program. Essentially none of us wanted to be a nurse at first. So
Mm.
we all kind of shared that sentiment, but we all had the same passion for people, passion for patients.
Mm.
So with that thought, I acknowledged that I was the only African American male in the cohort. Nobody else really spoke to that or acknowledged that, but there were times where I was given an opportunity to also be involved in their student engagement piece at
Uh,
the college. And I would go to speak to other potential students or other students that were coming in for orientation. And it seemed like every cohort behind me, there was also only one Black male.
mm. Mhm.
Only one. I don't know. I'm not going to say that was intentional, but that seemed to be a trend that I saw. There was only one, and we always bonded, and we keep in touch to this day.
Yeah, yeah. I can think of many benefits of having males as nurses. From your perspective, what are some benefits of having a male nurse in a hospital or, in a doctor's office?
For sure. The biggest one I would say in a hospital setting, especially for a nurse, beyond lifting. So honestly, a lot of male nurses are used for heavy lifting situations, for
Mhm.
safety situations as well, because sometimes nursing can be a dangerous job, especially all of my experiences in the experience of an ER nurse. So we deal with a lot of mental health patients there, or even drug
Mm,
addiction or alcoholism. And when you have a combative patient, they're coming for the male nurse to try to help
yeah.
and calm that patient down. But in
Mhm.
addition to that, just offering the patient body something different, just a new perspective, a new approach to healthcare, especially the male patients. Because, for example, and I kind of wrote about this, I'm going to throw in pieces of my research
Mm,
as well.
mhm.
African American men are 43% more likely to use the emergency room as their healthcare choice as opposed to going to
Yeah.
primary healthcare facilities. So if you see an African American male nurse while you're there in the ER and we're able to speak to why they should actually go to the doctor more regularly, I think that would help to improve our healthcare outcomes just by having more
Yeah.
males in the field.
Yeah, indeed. And we're going to get into what you've just said about in a moment. But let
Mhm.
me just throw this at you now while I'm thinking about it.
Sure.
I interviewed someone recently who was a double amputee due to diabetes.
Mhm.
And like a couple of decades ago, he said a doctor told him, "You are a typical Black man. You don't want to go to the doctor." So, why do you think that is the case? Let me just put it there now. Why do you think that he was offended by the comment, but the
Mhm.
doctor was probably more right than wrong? Why do you think that is the case that some individuals are reluctant to go to doctors to be checked?
Well, the literature states that men are less likely to go to the doctor than women. That's just baseline, no matter the ethnicity, race, nationality, what have you. In particular for Black men, because that's where my focus has been, Black
Mm,
men have less of an affinity to seek medical care for routine things or even follow up or checkups um,
mm,
for historical reasons. So, the medical mistrust that they have either experienced in trying to pursue healthcare, seeing their family members experience in pursuing healthcare, or hearing about things that have happened to us historically in healthcare. So, there is a higher level of medical mistrust among African American men, and in addition to that, the idea of what it means to be a man may play a role in that as well. So
yeah,
being comfortable enough to seek help with things before they get to be detrimental. So we don't have a problem going to the emergency room when we're about to die. But if we're
uh-huh.
not about to die, we got to go to work. If we're not about to
Okay,
die, we're going to take some Tylenol and keep it pushing because we got other things to do. And I think if more men saw men actually
mhm,
pursuing healthcare regularly and understood that this is not an expression of weakness.
mhm.
This is more so you taking control of your life and trying to make healthier choices, then we could shift the perspective of how we view healthcare. But right now we don't view we I don't think we see the value in healthcare as we
Yeah,
see the value in other things.
yeah. You know, I talked with a registered nurse, with a
Mhm.
nurse from Kenya
Mhm.
recently. And she also reported that men in Kenya were reluctant to
Mhm.
go, for regular screenings. And I asked her, I said, why is that? Her response floored me. She said, medical mistrust
Yeah.
is what she said. What do you think? I mean, does that surprise you that men in different regions of the world have the same feeling? Can I trust, the establishment with my health? Does this surprise you?
No, that does not surprise me. I think
Mm,
we have shared experiences despite our location.
yeah.
So, and as I stated, we've seen historically our mistrust in so many areas. So we have a choice on whether or not we're going to put our value or our time and effort into
Mhm.
something that we've seen over and over again not be as beneficial as it could be, then
Yeah.
we're probably not going to select that route. And we often, especially as this is another shared experience, have religious backgrounds. We
Mhm.
often will pursue more religious means for coping as opposed to going into um, hospital settings.
Understood. Okay. So what is it like working in an emergency room?
Yo, it is, there's never a dull moment, and it's unpredictable. There are certain trends that you can pick up on, like certain days that'll probably be a bit easier than others. But ultimately, every shift is different. And it takes you have to be a certain type of person to be ER nurse. It's not for everybody.
Mm.
Being an ER nurse means that you're not one to really see your patient day in and day out. I should probably only see you for a few hours at most. The motto of the emergency room is stabilize and disposition, meaning when you come in, the purpose is to figure out the problem, put a band-aid on it, either send you to the hospital that you need to go to for long-term care, send you upstairs to one of our rooms, or we send you home. The goal isn't for you to stay, but we're also seeing people that come to the ER for things that aren't emergent. So
Yeah.
you got the people that really need us in emergent situations, and the other people that this isn't emergent, but you haven't been educated appropriately. So
Yeah.
those are the ones that fill up the emergency room, and that's why there's such a long wait.
Uh-huh. Are weekends different from, let's say, a Wednesday night? Friday, Saturday is different from a Wednesday night in the ER?
Yes, so I have had the luxury of never having to work night shift. The most I've
Yeah.
ever done is an 11 a.m. to 11 p.m. shift, and that's enough for me. And I
Yeah.
don't currently work in the emergency room. I haven't since the very end of 2020, but I had 5 years of ER experience. I would say that in my experience, a Wednesday night is going to be typical. Um, the worst days that I've worked in the ER would kind of be it could be a Sunday morning because you have the drunks from Saturday night, or you have Monday morning where people have been really doing a number on themselves all weekend. And now it's time
Uh-oh.
to go back to work. And so they need to come back in to get a work note. So,
Mm.
or they held off on seeking health care until the weekend activities were over. And they come in Monday and we're flooded with these new patients that are in dire situations. So it
Yeah.
just depends. Every day is different.
Gotcha. Yeah. No, you're a nurse, you're a nurse educator. You teach nurses. So
Mhm.
being a nurse, with all that you know about health and wellness, has your health improved as a result of your education and training?
That's a very good question. Um, I think I just know a lot more. So I'm able to make the adjustments when necessary. One thing that I do stick with every single time is I'm going to get an annual physical. I have no problem seeking health care, but I didn't have a problem seeking health care before. So that
Mm.
hasn't changed on my end. More than anything, I'm just promoting it for those around me. I would say because of all the hats that I wear, there is a heightened level of stress. And because of that stress, cortisol goes up. And so my weight is not what it's supposed to be. But my
Yeah.
labs look great. So I
Yeah.
just try to make healthy choices as much as possible,
Yeah.
and promote health as much as I can.
After all, a healthcare worker is just like everybody else, right? We got to make choices to, every day to stay on track. So look, our country, and I talk to people from around the world, and I
Mhm.
can say that people everywhere are faced with a bunch of chronic health conditions. What's going on in our world in terms of chronic health conditions, especially in the United States? What's happening?
So in the United States, our most prominent ones are always going to be hypertension, diabetes, especially within the
Mm.
Black community.
Mm.
And those two things are often linked to food choices, diet choices, as well as behaviors. Often, I think in America, the focus has been on, especially when we think about healthy people initiatives. So, healthy people has been around for a long time, and they have the same set of goals that they're trying to achieve every year. So now we're in Healthy People 2030. And when we're looking at Healthy People 2030, I think we've placed a lot of emphasis on access. So making sure that we have access to healthcare, access to preventative health means, and increase access to make equitable decisions. But when it comes to the Black community, I would argue we have the access. We don't understand the benefits and we don't place our value in it. I think there needs to be more emphasis on the value of these healthcare initiatives as opposed to just making sure they're available. Because it can be free and across the street, but if I don't see the value in it, I'm not going.
Yeah, I mean, you teach courses on pharmacology. I know you've studied pharmacology. From a look at you, is it a part of our culture? I'm talking about just culture of people generally to think that a pill fixes it, as opposed to think first that lifestyle may, create better health outcomes for me. Do you think in our culture we think pill first as opposed to lifestyle first? What do you think?
I think we definitely have a microwave culture. Instead of putting in the work for the lifestyle modification, we would like to, oh, I can take this pill and still do what I need to do, and or still be the same way. And I think that's the problem. Like we haven't been properly educated on how to make lifestyle modifications that are sustainable. Sometimes
Yeah.
we say things, especially in the healthcare field, where obviously we have a list of foods that we should avoid. Obviously, we
Mhm.
have a list of exercises that we should do. But if you're telling an obese person like myself, stop eating fried chicken, no, like that's not gonna happen. So either
Mhm.
stop eating fried chicken or you're gonna have to take this pill. I personally don't want to be on a pill. I don't,
Uh,
but that doesn't take away the allure of the fried chicken.
uh,
So which one is gonna win out? And I think if we
yeah.
made lifestyle modifications seem more attainable, we would have a better indication of what we can do to help people. But right now, we're so inundated with, I want fast results. I want quick.
Yeah, I got
So I
I got you, right?
agree.
Yeah, I guess all or nothing is a tough choice. It's like, but maybe 8 out of 10 would be something that a person can work with, you know.
Hmm.
80,
Hmm.
80-20 rule, as they say. And
Exactly.
then, a registered nurse, master's in nursing, but you are a scholar. Is there a point where you made that shift? I mean, I know that you are a nurse, but to being a scholar, was that a shift for you or what? How do you explain that?
So for me, even while I was in nursing school, remember, I initially started nursing school with the thought that I would become a nurse practitioner. That is far, I don't want to do that anymore.
Mhm.
And it's for a number of reasons. While in nursing school, I had the ability to become a graduate assistant. And in being a graduate assistant, I had the ability to teach some of my peers health assessment, teach some of them skills and lab stuff and all the things. And they would just, in a nutshell, eat it up. They would just say, "Oh, you have a way of teaching where it really sticks." And I never thought I would like teaching.
Mhm.
That was not even a thought, or I didn't even know that that was an arena in nursing. And I love it. Like it fulfills me more than bedside nursing could ever fulfill me. So
Mhm.
even at the very end of my clinical experiences as a nursing student, I knew that being a bedside nurse was temporary. I knew that before I even finished, especially getting into that bridge to PhD program. Being a bedside nurse is amazing, but you can easily be burned out at the
Yeah.
bedside because of what it entails, especially within the department I was in. So, having my master's degree in nursing is what also opens up the door for me to go into academia. So just in having that master's and 2 years of nursing experience, I could be a clinical instructor. Or now I'm the one taking students to clinical. Or I can become a full-time faculty member and teach the things that
Mhm.
I'm passionate about. And then in terms of like research and article writing and things of that nature, that's not necessarily a passion of mine. I know how to do it simply because I had to go through a PhD program to learn how. That's not what I want my career to be based on. Will I participate in certain research initiatives? Sure. Will I write on it? Fine. I don't mind writing. But my goal is to teach. My goal is to be with the people implementing what the research is saying we need to implement. Because ultimately, if all research is to better the public, I want to be a part of the
Mhm.
public and making sure that I'm making that change.
Hmm. Yeah, you mentioned that, writing is not your number one passion, but you've published a very fine article on Black male health. So you and your co-authors. So I'm going to talk about that article a little bit. But first, my first question, what would you say is the status? I know you care about the health of all people in the country, but you do have a passion for Black men and their side of their health. Well, how would you rate our health today, the status of Black men? Men.
Yeah.
I mean, where would you put us on a
So
scale of 1 to 10?
it's funny that you would ask that question, especially in light of the article that I'm sure you read. My article asked men to rate their own health.
Okay.
And that was a variable I had to get rid of by the end of the project because how we rate our own health is not, doesn't coincide with our actual health outcomes. So
Mhm.
I could rate my health, or even if I'm referencing the article, men were asked to rate their health on a level of poor, fine, good, excellent. And most said good or excellent, but most of the men in my study had at least one, if not more, chronic health conditions.
Mhm.
So that doesn't correlate to what your current health status is. So where I
Right.
would rate Black men's health, I would say it's poor, simply
Mhm.
because we don't even have the self-awareness of how we could be better.
Hmm. Wow. But that you just stopped me in my tracks right there with that one. Okay, so let's dig into this a little bit because there's some serious stuff here. You mentioned the mortality rate in the article of Black men, and it was like Black men in the United States have a 40% chance of dying earlier than white men. That's shocking. That's like, whoa, wait a minute. So tell us about that. What's going on here?
The focus of my article was on preventable healthcare. So,
Okay.
in looking at disease processes that Black men have an affinity to, so beyond hypertension, beyond diabetes, it also looked into sexually transmitted infections and it looked
Mm,
into um, prostate cancer.
yeah.
So, some disease processes, like, there's no way that we can prevent prostate cancer in a way, but if we have it diagnosed earlier, then we can treat it better and hopefully get rid of it. Our problem is we're not necessarily seeking, or I wanted to see if we were seeking preventative healthcare measures readily so that we can have better diagnoses and make the changes earlier to hopefully improve our health outcomes. I think that overall, if I'm going beyond preventative healthcare utilization, I'm just talking about health beliefs and health choices. There are
Mm,
so many differences between the Black experience versus other groups. And there are other things that are causing us to have um, worse health outcomes as well, from stress to where we live, the food quality, etc. But I didn't focus on those in the article, but
yeah.
those are absolutely other factors that other groups may not experience.
Yeah. Now you mentioned prostate cancer, and the research is pretty clear that
Mm.
Black men have a higher, you correct me if I'm wrong in this instance, of prostate cancer than some other groups. Do you think that we talk about this enough as Black men? I mean, just to make sure people are aware that, look, this is an issue that you got to
Mhm.
be aware of. Do you think we talk about this enough?
So I'm aware that this is talked about, especially from the doctor's office, because something that at least the sample that I had for my research showed was that we go to our physical. So I
Okay.
think we've done a great job of making sure Black men go to the doctor for at least for their annual physical. And so if you're of age to get your prostate checked, that has to come up in that physical. A better question is why don't we partake in that screening? And I think that the way in which the screening is done is the reason why we have such a bad prognosis. Because to check your prostate means that typically the doctor has to do a rectal exam, and
Right.
no one wants to feel emasculated in that. So that in
Mm,
itself, we're going to avoid that as long as possible until there's an issue. You likely notice that issue when you see changes in urination. So
yeah.
I think it's talked about. It's just a matter of do we have an understanding of what it entails and what it could prevent if we actually participate in that screening?
Right. So is the PSA, do you think the PSA then, and you can tell all of us what that means, is a reliable blood test to determine prostate cancer?
So from what I know, and I'm not going to sit here and tell you I know everything, but from what I
Mhm.
know, it's reliable, but I think it's a later finding. So you can have an enlarged prostate and that PSA might not correlate at that time. But if you're finding out earlier on just from the rectal exam that it's enlarged, we can do more deeper testing to figure out what's going
Yeah.
on.
Yeah. So I'm just trying to I think about this because I mean, let's face it, you go to the CDC's website, they talk about prostate cancer in Black men. So it's something that we do know about. I'm wondering, how can we be advocates? Can
Mhm.
we do it through community centers, in the churches? Can people just talk about this so that people can be, diagnosed early on? These screenings are important.
Yes.
What I'm saying is that we need to get the word out. So how can we do this? Is it all of these things, or what do you think?
So one, I think the doctors are doing their part. I think there's something
Okay.
that we do as men in the healthcare field, especially Black men in the healthcare field. Community outreach is necessary. There's literature that supports the importance of using barbershops as well, because Black men are going to get a haircut. So
Yeah.
there have been great strides in screenings and testing in barbershops. And not saying that we got to do a prostate exam in a barbershop, but even if we talk about it there, if we talk about it at church, if we're more vocal, especially in churches, because we often have a religious affiliation, if we talk about it more openly in churches as opposed
Mhm.
to God is enough,
Mhm.
then because He is, but
Mhm.
let's not say it in a way that downplays other resources that God has also provided to make sure that we're making healthy choices. So we
Mhm.
have these open dialogues and open conversations, and more people are actually participating. Because another thing that we have is, I call it the brotherhood complex. If I don't see other brothers going to do this and other brothers aren't talking about this, I'm not
Mhm.
getting ready to be the one that stands out. So if more brothers were doing it and openly saying that they had it done, then it wouldn't feel like you're on the island by yourself, if that makes sense.
Mhm. Yeah, that makes sense. Yeah. But do you think that patients, wherever they are, tend to defer to you all to be responsible for our health care? Hence, we are not advocates because we expect you all to do it for us, the nurses and the doctors. Do you think that's
Yes.
holding us back?
So something that is ingrained in us as nurses, we are supposed to be advocates. And
Mhm.
that's just the role that, of all the roles that we play, of all the hats that we wear in being a nurse, we have to do our due diligence to make sure that we are meeting people where they are and having those tougher conversations.
Mhm.
Um, And I have those conversations and I make myself available, especially for the Black men around me,
Mhm.
where I actually just had a conversation about prostate cancer screening a few days ago with one of the brothers from my old church. And he was asking questions and I freely gave him answers. And it's just about making it less scary, just make it
Mhm.
less of a daunting task and help people feel supported in the decision that they make.
Mhm.
Um, so I operate as an advocate, and I know that a lot of other Black men in healthcare do so as well. Problem is, there's just not that many of us. So,
Yeah, yeah, yeah. Yeah, you also, and I wasn't aware of this. Well, I guess intuitively I should have been from your article, because it seems to me that you and your co-authors wrote that educated men, or men with, more resources, tend to do the screenings more than men. Can you talk to us about that?
sure. I think so. If I'm thinking specifically about my sample,
Mhm.
the men who participated in my research were highly educated. Most had at least a bachelor's degree, if not higher. And when we think about even academia, at some point we've all had a health class, right? We've had that in at least high school, probably grammar school, but you have them a lot when you're seeking higher degrees, especially if you have an advanced degree. So if you're constantly exposed to that, you're constantly going to know what you have at your fingertips, what's available.
Yeah.
In addition, you're probably going to be higher education's often, not always, but often linked to higher levels of income. So with higher levels of income, you also have higher likelihood of resources and higher access. So those things are intertwined with each other. And therefore, the more education you have, the more income you likely have, the more you understand what's available to you.
Hmm. Yeah. You know, I want to talk with you now about nurse education. I'm not
Mhm.
sure if you recall, I contacted you on LinkedIn.
Mhm.
And what prompted me to contact you to ask if you would talk to me is that you were with a group, I would think more than a dozen or more men
Mhm.
who were pursuing nursing, certifications. So you are a big time mentor, aren't you? Can you talk to us about how do you try to encourage men to consider nursing as a career?
Okay. Well, first things first, that picture that I'm sure you're referencing was something that I
Mm.
posted where it was men in nursing. I did not create that group. That group was
Oh,
created by Dr. Aaron Franklin, and he is currently working at Rush University. So majority of the people in that picture were from Rush University. They're men in nursing who I believe they're pursuing a master's degree or higher at this moment. However, there are some men that I brought along. So one of them is currently a student at Chamberlain University, where I currently work. And another one is an alum from Chamberlain who I mentored, who currently works at Rush. So it was just a hodgepodge of connection in that picture. And becoming a man in nursing is not an easy feat. One, you have to go against the grain because you're not going to see that many examples. In that particular picture that you're referencing, it was majority minorities, right?
mm,
Like a lot of most of them were black, but that I'm just gonna call a spade a spade. When I have a black male nursing student cross my path, I automatically reach out to them. If I see you in passing, I'm probably going to say something to you just so that you know you're not in this alone. You have me as a resource. Reach out to me if you need me. And by the end of your journey, especially at my current campus, I typically have built that relationship with the Black male nurses in particular. Definitely, but I also make myself available to all male nurses in general. I'm
mm,
obviously starting and helping to start an organization now as we speak. But it's necessary because if I had that, who knows where else I would be? Not that I did bad, but having more of an example or even being the example was something that
mm,
was dear to my heart. That is why I pursued the PhD in the first place, to be an example. So if I did that to pursue it, I need to be that example to every single person that I see. Not every man
mm,
is perceptive or receptive, I should say,
mm.
to what I would like to do or how I would like to help them. Most are, though, because they need to know what's possible. They need to know what they can do even beyond being a nursing student.
Yeah, they need to know what's possible. I like that. I'm glad that you use that
Yep,
word because there are a lot of opportunities in healthcare. Am I right?
very much so.
Yeah, I mean, I've seen some gadgets, unbelievable gadgets that nurses use.
Mhm,
Looking inside of the heart. I mean, God, I'm like this. That's awesome. I think, whoa, lots of opportunities. Let's get it done. So,
mhm.
what are the barriers you think of men pursuing healthcare as an occupation? Are there barriers to that?
Yes, not in terms of availability of slots, but more so even to just get them to apply.
Uh,
So some of it is just perception. I think our biggest barrier is perception. Our biggest barrier is social media as well. So
mm,
having the notion, even take this for example, because this
mm,
conversation kind of came up before. The question was, is there a stigma associated with being a male nurse?
mm,
And immediately everybody says yes. And then the question was asked, well, where's the literature to support that?
mm.
The fact that we say male nurse is the support
Yeah.
because a nurse is a nurse, right? But the fact that we have to put male in front of it means there are not a lot of them, so we're an anomaly.
Mm.
That's an automatic stigma because we're labeling somebody a male nurse. I'm just a nurse. Don't call me a male nurse. I'm a nurse. I also
Right.
don't like being called a nurse because they try to merge the two together and make that a word, nurse
Mm,
for male
mm,
nurse. I don't like that either. I am a nurse and it is okay to be a nurse. I chose this profession on purpose. And
yeah.
often, even once you get that degree, you have to tell your patients to respect it too. So
Yeah.
I've walked into rooms and they assume I'm the security guard. I've walked
Yeah.
into rooms and they've assumed I'm a CNA. Then I tell them I'm the nurse and we do all the things. I educate them, start their IV, get ready for discharge.
Mm,
And I've been told, make sure the next time I come back, you're the doctor. That's not my goal. I'm
yeah.
content with being your nurse, and it's okay.
Understood. It is okay for sure. And perhaps being a male, I mean, nurse is a
Mhm.
superpower. I mean, and I get you there because sometimes patients respond better to males, once they get past your title. Yeah, look,
Hmm.
I saw something around you that's called, oh, before I get to that, though, I got to ask you this. We talked about your training earlier, as a student and going all the way to the PhD. Have you taken courses in mental health? And how does that show up in terms of, one of your passions, Black men and their health? Do you think Black men are responding to um, opportunities to at least look at their mental well-being?
So, very great question because this kind of ties into some other passions that I have. The only, how can I put it? I've had like mental health classes, not specific to like psychology, but like literal mental community health type courses in my undergrad. Also took mental health nursing in my nursing program. And I've had a lot of exposure to mental health patients as an ER nurse. Currently, I'm pursuing a certification to become a Christian counselor.
Mhm.
And that is because of my passion for Black men's mental health. We
Mhm.
surely do not take our mental health seriously. If it's hard for us to get our prostate checked, how
Yeah,
hard do you think it is to acknowledge feelings? Like,
yeah,
it is
yeah,
okay for us to be overwhelmed. It's okay for us to be sad. It's okay for us to have all the feelings that society tells us we shouldn't. And often I'm checking in on my friend groups just to see what their mental health is like. Hey, I care about you if you don't know anybody else does. Tell me what's going on. I'll have those kind of conversations, or I'll send just a general text like, hey, if nobody else has told you you matter, you're valued.
yeah,
Because and it probably also comes from a place where I would love to receive that too, because you're not going to feel 100% every day. But if you know that somebody's in your corner and that somebody gets it, especially from the male perspective, that speaks volumes. So
yeah.
once I become that counselor, my goal is to offer some sort of free service, but
Uh-huh.
more to come on that.
Uh-huh. Free services. Whoa. You're generous with your time. That's awesome. I saw something else around you. It's called the Keepers of the Flame. I didn't
Yeah.
dig into it. What is that about? The Keepers of the Flame.
Okay. Keepers of the Flame is a group dedicated to the fundraising efforts of the Sickle Cell Disease Association of Illinois.
Mm,
So my aunt died from sickle cell in 1986. And then my
mm,
uncle started the team called Keepers of the Flame in 1987. And so from
mm,
that point forward, they've been one of the most consistent and top fundraising teams for the Sickle Cell Disease Association of Illinois. So what does that
mm,
mean? SCDI, that's the abbreviation for the organization.
mm,
The home base here is on the south side of Chicago, and they have a walk, jog, bikeathon annually every year to help raise funds and awareness. So, although a cure exists for sickle cell right now, it's not
mm.
affordable. So, we have
Okay.
many families that have children or adults who still need resources. So,
Mm,
there at one point was like a sickle cell camp for children over the summer that we visited before. They have diaper drives. They just have ways to
mm,
support families who have been affected by sickle cell. And so our team's primary focus is raising funds and awareness. And so I know the Walk Jog Bikeathon for this year is coming up. My uncle we're co-leading the team together now, and we're trying to have some new initiatives because since COVID, it's hard to get people back out and doing what we used to
yeah.
do prior to COVID. But we haven't stopped in terms of our engagement and in terms of our passion for continuing those efforts.
I'm so happy that you're raising awareness about sickle cell disease. So to me, it's like prostate cancer. It's like a lot of people don't even talk about, at least in my area. Your
Mhm,
area could be different. It's not a conversation that comes up a lot. Sickle
mhm,
cell. Yeah.
mhm. I agree. I know that sickle cell is a predominantly African American disease, although
Yeah.
anybody can have it.
Mm,
And even, I'll be honest, in the healthcare field, from what I've seen, although I know that it has debilitating pain,
mm,
it's not looked at as a medical emergency. So
mm,
And and that was hard for me, a hard pill to swallow as an ER nurse, because as I'm triaging patients, especially with my own personal experience and having an aunt who died from it, as I'm triaging a patient
Yeah.
and they tell me that they're having pain from sickle cell, immediately my brain says, okay, we need to get them a bed quick.
Yeah.
But
Yeah.
they're not going to get a bed over someone who has other ailments that have been deemed a bit more higher acuity. Uh,
Uh-huh.
I'll still put them as a two on the
Yeah.
ESI scale of 1 to 5, but that's not how all of healthcare looks at them.
Yeah. And the families who have loved ones with sickle cell anemia, they see it as an emergency for sure.
Exactly.
Yeah.
Exactly.
So, yeah. Well, Dr. Jordan, I enjoyed our time together today. Is there anything else, though, that you want to share with us before we sign off?
I think your line of questionings really dug into some things that I'm trying to do. At some point, I will talk through um, the journey in academia to get the PhD. It was not an
Yeah.
easy one at
Yeah.
all, especially in being a Black man in a white academia.
Yeah.
That is different in itself. So that it
Yeah.
also speaks to the idea of what's possible, because
Right.
you're going to come up against obstacles, but
Yeah.
as long as you keep pressing forward and you have examples, you got to do what you got to do so that you can be the
Yeah.
person you've intended to be. But
Yeah.
ultimately, you hit majority of the stuff that I would love to speak to.
Yeah. I'll tell you what, I enjoyed it. And you got your PhD in 2023?
Yes, I just graduated
Yeah.
1 year ago in May.
Congratulations.
Thank you.
I came through in 1987.
Oh,
That's
wow.
almost 40 years ago. Can you imagine? But that's another conversation. I'm not the guest. You are. Hey, look, I really enjoyed our time together. Dr. Jordan, thank you so much for saying yes when I invited you to join me.
Thank you so much for the invite, Dr. Middleton.
Okay. Well, you've been listening to the Possibility Action Network podcast. Our guest today has been Dr. Harrell Jordan. I'm your host, Stephen Middleton. Until next time, good day. You are not alone, just keep